If you put in any implants in any patient, I want you to consider this product that I'm going to talk to you about. I am at the Arizona Urological Society Meeting 2023 down here in Tucson, Arizona, and I'm very, very pleased to have Michael with Irrisept to talk to us about their product. And it's something that has been used across the country. A lot of people are using it, a lot of hospitals are using it, a lot of urologists are using it, as you may have learned in the Thriving Urology Practice Facebook group. This may help you with your implant success by minimizing infections. So, Michael, thank you so much for letting me interview you. Tell us a little bit about Irrisept.
Absolutely, I appreciate it. So Irrisept is a low concentration chlorhexidine in sterile water. Two ingredients, that's it. Comes sterile packed, sterile sealed, ready to go, ready to come into the room. No pharmacy involvement, anything like that. It's absolutely the exact same concentration every time, whether I open it or you open it. So we have consistency coming in and out of the OR and over our procedures. It's been phenomenal. Irrisept has been, right now, as of now, we're roughly in 4,000 hospitals, 4 million uses. So,
You know, when I didn't learn about this product until relatively recently, when someone presented at the Phoenix Urological Society
yep,
meeting, and that's how I learned about this product. So part of the reason I'm doing this video is just to get the word out, because results have been apparently very, very nice, very effective.
absolutely. Yeah, we had Dr. Ed Cartman out of California. He did that talk, and he talked about his usage with it in the IPP setting, with not only the prep, but on the patient as well. And success has been phenomenal. You know,
So I'm thinking not just the penile prosthesis, also the artificial genital urinary sphincter, or sometimes post-implant infection, and you have to clean the field.
Absolutely. Absolutely. It originally came out for kind of known infections. The paradigm is now flipped. It's almost all prophylactic use. Obviously, in a known infection, it's a phenomenal setting, but any kind of implant, like you're saying, a sphincter case, a sling, anything like that, or we're also now being seen in bladder installations, so chronic UTIs.
So that is something I'm very, very interested in. Some patients unfortunately have to suffer with this recurrent urinary tract infection, sometimes with a suprapubic catheter or chronic indwelling Foley catheter. Tell us a little bit more about the studies that you are doing or have done regarding recurrent UTIs and the use of something like this.
Yeah, so absolutely. We don't actually have a true protocol for the use yet. We have a bunch of studies going on. University of Tennessee is probably doing our biggest one. They're seeing great success. We should have that data soon. Right now, what we're trying to do is establish kind of a baseline and a true protocol for the dwell times, the dwell volume. But what we've heard is preliminary is fantastic outcomes. Patients getting longer and longer in between installations.
So in the study, I know it's probably not published, right? Results are not published. How are they using Irrisept in that study?
So what they're doing is that essentially it's been 3 dwells. So it's a 450 ml is our main bottle. That's our main driving product. It's 450 mLs. They'll do 3 dwells at 150 each. And then they're trying to figure out the intermittent time, whether it's a 5-minute dwell, a 10-minute dwell. They're warming it so you don't get any kind of bladder contracture. They'll fill it and then just kind of let it dwell and then self-drain and then fill it again. So again, you're talking about a whole lot quicker procedure with the patients. It's uncomfortable to sit there with a full bladder, and it's a lot more cost-effective, given no antibiotic mix or anything else, depending on what they were currently using.
Awesome. So from what I'm hearing you say is that the patient with recurrent UTIs with a chronic indwelling catheter will come into the office. You put in 150 cc's, let it sit for whatever the time that you think may be effective, because we don't have a protocol, there's no guideline,
Correct.
and then drain it, and then fill it again, and then drain it and fill it again.
Correct. Yep, absolutely. And that's where these studies were trying to figure out what is going to be our best baseline, whether it is it 3 dwells, is it 2, we don't know. And that's kind of what we're hoping guys like you will help, we can figure that out and establish a true protocol moving forward.
So guys, this is an ongoing study. This is not a recommendation, but this is just something that you are studying.
Yep.
And we're not telling you what to do. It's just something that is being investigated to minimize these recurrent urinary tract infections. Can you show us, I know the Irrisept comes in 2 different sizes, 2 different bottles.
Correct.
Show us what that looks like. And when I see this is an empty one, I'm thinking of
Yeah, absolutely. So this is how it comes into the room. This is how it's packaged and shipped. So as I said, it's sterile packed and sterile sealed, double blue wrap. So it comes ready to rock and roll. Pop it, open the first blue layer, and pass it off onto the field, and it's ready to go. As I said as well, same concentration. So we don't have to worry about mixing or inconsistencies. That's been kind of the big push with us.
So there's no prep. You don't have to shake it. You don't have to inject anything.
It is stored at room temperature. There's no prep at all. Again, like I said, for bladder, you can warm it. Just know that you can warm it to 104 degrees. So anything else you would warm saline or anything like that.
So this is the larger bottle. I know it comes in a smaller container as well.
Yep, we just had so now it's 150 ml. Still sterile packed, still sterile sealed. But again, used for maybe smaller procedures. If you don't think the 450 is necessary, we now have this as well. Also very cost effective.
Speaking of cost, tell us a little bit about the cost for either a small practice or possible. I guess everything is negotiable, right? So depending on volume, or how do you guys set this cost structure?
Here's the thing: to protect our customers and make sure everybody gets the best cost, we have an umbrella agreement. So we are the same cost all over the country. It's distributed through Medline, Cardinal, McKesson, whoever you choose to order.
EuroGPO?
Yeah, whoever you want. If it's a distribution network, you absolutely can order through it, and then you have their markup, whatever you agree upon, which should be no more than 1 to 3%. So you're still talking about a very cost-effective product at roughly $70 a bottle, opposed to again, pharmacy involvement or triple antibiotic starts getting very, very expensive.
Well, I see utility in the clinic setting as well as in the operating room.
Absolutely. And that's kind of where it started to shift more as well in the clinic setting. And then again, it's stocked as just a regular item. So in your clinic, it would be how you would order gloves or, anything else, gauze pads, anything like that.
Well, thank you so much, Michael, for sharing your product and your knowledge.
I appreciate it. Thank you for your time.
And as always, if I have any financial interest in any company, anyone I interview, I will disclose that. I have no financial interest in Irrisept. Hope this was helpful. Thank you so much for the privilege of your time. Please take care of yourself and take care of each other.